According to the CDC, in the United States, someone has a heart attack every 40 seconds, and the leading cause of death in North Carolina is heart disease. So having access to high-quality cardiovascular care in our community is invaluable. I'm here in Scotts Hill with Dr. Christopher Ellis. He's a cardiologist with Novant Health Heart and Vascular Institute. Dr. Ellis, what is a heart attack and why are they so prevalent?
Well, a heart attack is a condition where one or more coronaries become severely or completely blocked, and that leads to a part of the heart muscle that doesn't get blood flow like it needs. If it goes on long enough, that causes injury. Heart attack typically is caused by a disease process called coronary disease. People also refer to this process as hardening of the arteries or coronary atherosclerosis. And in that condition, plaques build up in the artery walls, and if bulky enough, can lead to significant obstruction of flow to a heart muscle. Sometimes these plaques can rupture or fissure, leading to sudden blood clot formulation in the artery, which will ultimately lead to restriction in blood flow and heart attack. That's typically what most heart attacks are caused by.
And why are they so prevalent?
So it's due to the prevalence of risk factors in our population. Things like lifestyle choices, other health conditions, age, family history all feed into that. Now, lifestyle choices could include smoking, poor diet, sugar, salt, fat, heavy diets, processed foods. Also, heavy alcohol use, stress, lack of exercise. And you look at the other health conditions that people have too, diabetes, high blood pressure, cholesterol issues. Even things like obesity and chronic kidney disease can feed into heart disease. Obviously, also, the older you are, the more likely you are to have coronary disease. And finally, family history. You can't do much about that, but it's important to know that ahead of time.
So how would someone know if they're at an increased risk for developing cardiovascular disease or a heart attack?
Generally, the same risk factors that we talked about just a second ago are how we figure out what somebody's risk is. There is a nice 10-year risk calculator that's published by the American College of Cardiology that's available on any phone, tablet, online, and can be done to help further tailor management plans.
And what should I do if I think someone may be having a heart attack?
If you or yourself or around somebody who's having symptoms that could be a heart attack, it's important to first call 911, get medical professionals on the scene. If you know CPR, then you can start CPR as well.
All right, well, let's go check in with Lizzie. She's in cardiac rehab. It's one of the critical components to post-heart attack care. After having a heart attack, many patients will need rehabilitation to fully recover. Novant Health recently expanded their cardiac services to Scotts Hill to make access even easier. I'm here with Lizzie Capps. She's the coordinator for cardiac services. Lizzie, why is cardiac rehab so important for your patient?
Well, a patient that completes a cardiac rehab program lessens their chance of having a future heart attack or being readmitted to the hospital. Cardiac rehab is a lifestyle modification program. Patients come in a class-type setting, they exercise, they go to education classes where they learn about cardiac risk factors and how to make healthy changes. We do stress management, nutrition counseling, tobacco cessation, and there's a really strong camaraderie in the classes because patients are with others who've been through similar situations. Patients leave with an improved sense of stamina and confidence, getting them back to the activities they enjoy doing.
Thank you, and thank you as well. For more information, you can visit novanthealth.org/heart. That's novanthealth.org/heart for more information or consultation. We'll see you next time.